What information do we have on this new variant? As a virologist, what can you share with us?
Well, we learned it's extremely infectious and spreading at an alarming rate within the UK. We have something like 1 in 45 of our adult population across England is now infected with this Omicron variant. So it is extremely infectious. And we have yesterday again reported the highest levels of infection across the UK that we've ever seen, more than 119,000 cases in 24 hours. So it's really spreading very rapidly.
Now, Professor Young, some early indications suggest, and I'm adding this rider, early indications suggest that this is a milder variant if you compare it with Delta. Will this be a correct assessment? Because the problem is that this information, if not true, may just lead to a lot of people slackening in their response.
Yes, so the early data coming out, and it's based on relatively low numbers, suggests that fewer people are needing hospital treatment after infection with Omicron compared with other variants. And this is varying levels, but it looks like around 50% less dangerous in terms of severe disease than Delta variant. But all this data is based predominantly on people under the age of 40. These are not older people because the virus has only just started to spread into the older population, and we know that the more severe consequences of coronavirus infection are found in older individuals, and also these individuals don't necessarily respond as well to vaccines. So even though this is good news and it's telling us on the whole that the Omicron variant is milder than Delta, we still think that there are so many people going to be infected that the sheer number of cases will inevitably result in some people getting sick, and that number of people will put significant strain on our healthcare systems in the UK.
Professor Young, my final question, lots of debate around booster shots, many countries questioning its ability to work. In India also, we are assessing whether it should exist or not. In your experience, do boosters work?
Well, all the data coming through suggests that they do work. And of course, one of the problems that we know with the vaccines, current vaccines, is that after a period of time, the protective immune response decays. And so, particularly in the elderly and vulnerable, it's important to top up the body's immune response. We think if you do that with booster shots, early data suggests that gives you probably something like 85% protection from getting infection and developing serious, severe disease. So booster shots seem to be very important, and this is something that I think is essential that is rolled out in as many countries as possible.